So when COVID first started, we implemented something we call the Incident Command Protocol. And that was a system that we have for getting all of our leadership together to really be able to synthesize the vast amounts of information that were coming in, both from federal, state, local organizations, our community partners, and internally from our care teams and each of our departments. And we were able to use that as a way to synthesize that information, get direction back out to the organization so that folks could continue delivering high quality care so that we wouldn't miss any opportunities. PPE was a wild ride. The first thing that happened as a result of the pandemic was a huge disruption in the supply chain. So literally we were dedicating hours a day on calling suppliers and really trying to identify the PPE that we needed and who had it and at what cost. And at times it felt like we were trading on the stock market. Things were a commodity. And it wasn't only one set of things. The recommendations for PPE changed during that time, and so we had to coordinate new information with getting new supplies. And we were really blessed in that the state of Colorado provided a PPE grant to us, and we were able to use that money to get a bit of a buffer so that we could always ensure that our patients and our caregivers had the appropriate protective equipment, and that if there were further disruptions in the supply chain, that we had adequate supplies.
COVID has impacted the PACE program in how we deliver care. It's also it had a very dramatic impact on our funding stream, especially through the state. And we work very closely with the state to try to figure out how do we navigate. I mean, they necessarily had to reduce rates across all Medicaid programs statewide. It's impacted every corner of the Medicaid world. With COVID, we've had to really turn that model around, and instead of having it face inward, we're very much faced outward. Most of our services are delivered in the community. We have our team going out into the homes. We are also working with telehealth, so we have quite a few tablets out in the community where folks were using telemonitoring devices as well as telephonic support to support our patients, keep track of them out in their homes. We also we're doing home delivered meals. We are doing home delivered rec therapy activities, which is really great. And we're also doing more and more services on Zoom, through Zoom meetings where people can jump in on a bingo game or a yoga class, or they're able to have group therapy. And we just want to continue to find ways to deliver the care in a really thoughtful and creative way that meets the needs of the participants while we're also navigating in an unknown economic environment.
I think with hospice being provided in home, in facilities, in our inpatient care center, our staff quickly found that they were the front line for these patients and really were playing a critical role in what was happening in their lives. We had to really move fast around setting up protocols, obtaining proper PPE to wear, and really keeping staff educated on what was happening day to day because it changed. We actually, in our inpatient care center, designated certain beds for COVID positive patients. I think the impact on hospice patients and families is actually really huge, whether they have COVID or whether they don't. We see patients in facilities that aren't allowed to have families and loved ones or visitors come in and see them. They're very isolated. All of these different scenarios really, unfortunately, are forcing some patients to spend their final days alone. Our role, I think, as hospice providers and as a hospice team is even more important than it was before in the new normal that we have now that COVID is here.
TRU really seamlessly transitioned into all virtual care the moment that we needed to with COVID-19. We were able to train all of our volunteer group facilitators on Zoom so that they were able to facilitate our support groups, and we did not miss one single meeting because of that. Our counselors were able to transition our individual counseling clients from in-person visits to virtual and/or phone sessions, depending on the preference of the person. And we have just recently started to be able to bring people back into the office for some face-to-face visits if they're comfortable and prefer that method of connecting. And it's been a journey of figuring out how best to meet people's needs while still continuing to be there for our community. COVID-19 has really presented some unique challenges to people who are grieving. Normally, we would be able to gather at our loved one's bedside to say goodbye. We'd be able to gather with friends and family to have funerals and memorial services. None of that has been possible during this time, and it's really been a challenge for people who are feeling a sense of lack of closure and really having trouble transitioning into their grief. Additionally, one of the things that we've been able to do to reach out and serve our community during this time has been to provide virtual workshops in kind of the whole realm of how to cope with grief in light of the isolation that we're all experiencing right now. That's been a really special way for us to be able to serve and connect with our community. One of the ways that our volunteers have continued to support our patients and families is by creating cards with encouraging messages that we've been sending to our patients, their families, and even our staff, just to say, we're thinking of you during this difficult time. Hopefully it brings a smile to people's faces. We also have volunteers that are making PPE kits for our staff to come and pick up. We have volunteers who are delivering telehealth tablets to our patients, ensuring that they're getting access to the care that they need. We have our volunteers who are delivering groceries to patients' porches who otherwise would not be able to safely get out and get what they need. So they've really risen to the occasion and helped us to come up with really creative ways that we can continue to serve people. The Conversation Project of Boulder County has really risen to the forefront of a critical program offering at TRU during the pandemic. Now more than ever, it's important to have conversations about your wishes with your loved ones, appointing decision makers, and really understanding, making sure that everyone in your life understands what it is that you want for your health care. The Conversation Project has a great group of volunteers who have been trained in how to help you work through what it is that your wishes are, and also help you communicate what those wishes are to the people in your life that would be making those decisions. We have seen a really big increase in interest for people evaluating their advanced care plans. It's been a really neat way to see that even virtually, we can continue to provide this really great support to all members of our community.
That week that Eric was in ICU, due to COVID, I wasn't allowed in to see him. The last time I saw him was at 2 a.m. that Tuesday morning after his heart had stopped. And they took him away to the cardiac cath lab. The next time that I was able to actually lay physical hands on him was when his daughter and I made the decision at what time to pull that ventilator and let him go. In between, thank God we have telehealth and the iPads, because the staff at Good Sam, ICU, the chaplain over there and everything, they were able to FaceTime him. So I was actually at least able to see him and talk to him. And so was his daughter, and his friends, and his family, to actually say goodbye. Because when we really did say goodbye, there was only Macy and I in the room. Because that's all that was allowed due to COVID. There was only the two of us allowed. So she was on his left side, I was on his right side. So yeah, COVID and grief, it's hard. When your loved ones are in a facility dying and you can't be there, the benefit is being able to have our staff there, or the telehealth that we offer, that we'll have the iPads in there and the nurse will hold it up so that they can communicate with their family. And that is huge. So the fact that we're able to offer the telehealth to give families that little bit of peace.
Yeah, I think the pandemic had a vital role in how we did our telecare. Fortunately, Michael McHale, our president and CEO, has had a vision for years to incorporate a telecare program into our organization. And we actually started rolling out our program in December of 2019, so way prior to the COVID pandemic happening. I think because of this unique program, back in March we were able to evaluate which visits could be provided via telehealth and which ones could again be implemented by the daily monitoring so that we didn't actually have to go in and see the patient, but the patient was constantly being monitored by a nurse. We found that many patients and family were very grateful for the opportunity for us to be able to do our visits telephonically. And really knowing that with the remote patient monitoring that we were constantly keeping our eyes on them for any changes of condition. We were able to support the families in making sure that they knew what was coming next and providing support that they needed at that time during that day.
The funds that we raise at the thrift shop supports TRU Community Care's missions. It's one of the most amazing things to me was when we reopened for donations. We had a traffic jam of people with full cars, so excited to help us get back on our feet, so excited to donate. I kept hearing over and over, I've been home sorting for you guys, and it was amazing. It felt great. It was really difficult to manage. We didn't know how we were going to ever get through all these donations. And in the first few weeks, we had to sometimes turn people away, but they were generally fine about it. They knew things were hard, said, don't worry, I'll be back next week. So it was really interesting to see the number of donations coming in.
As you can imagine, COVID-19 has severely impacted our fundraising efforts. On the positive side, grant giving has increased significantly. We've received a generous grant to help offset the costs of PPE. We've received multiple grants in support of our telecare program. But on the negative side, the economic uncertainty of this time is really taking its toll. Individual giving is down, corporate giving is down. We lost a lot of revenue in our thrift shop. We've been unable to gather in large groups for our fundraising events. That is why we're asking you to support TRU Community Care today. It's more important than ever before that you give generously in support of our mission. Thank you for standing with us.